Okay, in this video, I'm just going to run quickly through the CVD workflow. So first of all, I log in. Now make sure I'm on the home screen. And then to open up my patient, I would click patient search, and I would either search for my patient, or if I've recently interacted with them, they'll appear in this list. And I want to open up Andrew. So I simply click on his name, and that opens up his consult screen, which is also his medical record. So just to give you a very quick kind of overview of the consult screen, all of the patient's demographic information, including their funding and enrollment information, will be displayed up here. And you can also, if you wish to see their enrollment profile in more detail, you can click this icon, or if you wish to see their family members, you can click this icon here. Now, their most prominent clinical information will be displayed below. Their problem list is here. Any long-term medications they're on, any allergies they have, and then any alerts that are on their file will all be shown up here. And down the bottom of the screen, this is more the sort of clinical work area. So you have your patient note functions. Those are all your kind of clinical tools you will use to carry out the consult, including note entry, which is what's currently open in the center pane. So when you click on any of these, it will open up in the center, and you can either enter your notes, or you can enter an examination, blood pressure, and so on, or you can order test results, enter diagnosis, etc. Over the right hand side, you will see all of the patient's prompts. So the prompts have been generated by the system based on defined criteria, and those can either be, for example, demographics, the patient's age perhaps, or they can also be created based on diagnosis. So because this patient has a diagnosis of CVD, certain prompts were automatically generated by the system. So when you open up that screen, you'll know that these are the sort of things you should be looking at, and you can click on any of these and a relevant window will open where you can enter the information. Or for example, if the prompt is recommending that you generate a recall, you can then generate the recall by clicking on the prompt, and we'll open up the recall form. Now, if I click on patient timeline, the timeline is the complete medical record of this patient. So every single interaction that's happened with this patient through this practice or through other services that are related will be entered into their file here. And I can search using any of these filters, or I can search by free text, by date, and so on if I want to see something specific within their record. And whenever I enter any notes or prescribe a medication, as soon as I do that, that will enter into their record, and I'll be able to see who entered the information, when, where. So the next tab is the patient inbox. So if I've ordered any test results for the patient and they come back, they'll come into the patient inbox. And if there are any test results that are outside the normal range, they will be highlighted in red, so I'll know straight away. And then I can click into these and see exactly where that abnormality lies. So the system will indicate to me the abnormal data, and it will give all sort of relevant data around these test results. And then I can work through the results by clicking file, and as I file each one, it will take me to the next one. And as soon as I file them as well, they will be sent to the patient portal, so the patient will then be able to see their test results as well. So as I said already, I would use the notes entry panel to enter any consult notes I have. And I can also access a CVD enrollment template by clicking on the BPAC common form icon here. So I click there to access that. And just in terms of diagnosis, I click on diagnosis coding in the left-hand panel. That opens up the diagnosis panel, and I can see all the long-term diagnoses that are on the patient's file, as well as any diagnoses captured in the last 3 months but haven't been marked as long-term. And if I clicked history here, I would see a complete history of their diagnoses. If I want to enter a new one, I simply type it in this search field here, and after I type in at least 4 characters, the system will then start to generate suggestions, and I can click on the particular one I want. As well, I can see procedure history, family history, and so on through these tabs. And I can use any of these quick keys to add the diagnosis to the problem list, in which case it will be displayed up there. Now, certain diagnoses could have resources linked to them in order to provide education on them. And if you see this icon next to any diagnosis, you can click on that and that will take you to a link to whatever, whether it's a document, whether it's a third-party website, you can access that resource information. And you can also access it through the resources tab here, and those resources can be sent to the patient's profile as well, so the patient can have the benefit of viewing that information and help with self-management and so on. Now, if I want to create a prescription for this patient, I would click medications, and then first of all I will see, kind of like diagnosis, I'm going to see all the long-term medications the patient's on, as well as any that were prescribed the last 3 months but weren't marked as long-term, and I can highlight them from here, etc. If I want to prescribe a new medication, I will just type it in here and search for it. For the purpose of this kind of demonstration, I'm just going to search for something simple, and once I do that, then I click on the medication I want, and that will open up the prescription form. There will also be a warning of any drug interactions will appear if there is a risk, and if I try to prescribe a medication that the patient is allergic to, a warning would pop up as well, telling me that the patient has an allergy to that medication class. So once I click OK, the prescription form opens up. I can expand it, and then I can specify exactly how many they should take, and the number of days and the frequency and so on, and you'll see those instructions automatically populated. I can add to those if I wish. I can mark if it's going to be long term. If the patient needs any repeats, I can put in the number there, and then once I've entered all the information, I click save, and the medication is saved in there. And then if I click this, I can print a prescription for that medication, and also a recall can be added against the medication as well to remind the patient to take it at certain intervals. So all of that you can either do it yourself, or that can be automatically added against any medication. Now, in terms of referrals, if I want to add a smoking cessation referral for this patient, I would click this icon here, and it opens up the referral form for smoking cessation services. For any other referrals I want to add, I would click service eligibility determination to expand that section. I would then click specialist referral, and then I can search for referrals down here. So for example, I can say private service, and then I'm going to say Auckland Heart Group. And then once I open it up, I can see information about the service, and all this information is taken from HealthPoint. So all that data comes in from HealthPoint, and Indice has this very flexible referral engine, so we can incorporate any number of specialist services in here, and then you can instantly use this engine, which is in essence a secure messaging engine, to send your referral to those services. And all I have to do is simply click on the specialist I want, then I would enter a reason for the referral, and I can include, now this is just a sort of generic or sample referral form we've created. These can be customized based on particular practices requirements, but for the purposes of this demo, and also to give the provider the ability to pull in as much information as they require without having to actually really type in anything, we've created this generic platform. So for example, they can easily pull in today's consult notes, or they can select previous consult notes, pull them in from there. As they go through the tabs, you'll see that they can pull in any of the diagnoses the patient has, any of their medications, any results within their inbox can also be included. Images can be uploaded from their local machine, and then they can review the patient demographic information, which is automatically populated within the referral, including next of kin, emergency contacts, and so on. And they can also review the patient's default or registered GP, that information there. And then it can be marked that the patient has given consent. And lastly, you would go to the preview and submit stage, and then you can either send and print or send via HealthLink. And if you click send and print, for example, the print window will open, and you can print off the referral from here as well, so you have a hard copy of that referral. Now, if you want to add a care plan for the patient, we just go back to the patient note functions and click on health plan here, the health plan interface will open up in a separate window. If the patient's on any health plans at the moment, because they can have a range of them, they will all be displayed here, including all the activities that have been achieved, that have not been achieved or are still in progress, and so on. Any sort of messages, any appointments or future appointments to do with this health or care plan, and also the different care team members who are involved. And if I go over here, I can click add care plan to add a new care plan, and then I would enter the name, a code. I can select the category. There's pre-populated or predefined categories I can choose from. I would mark the status. By default it's active. I can attach a diagnosis to the care plan. So if it was a care plan for smoking, for example, smoker, I can specify that here. Or CVD or whatever it is, I can put that in here. I can enter description. I can choose different care plan templates. So these plans can have different predefined templates set up that you can select from. And then down here, I can add the members of the care plan team. So all the users on the system, I can select them from here. And I can also add, relevant specialists who might be outside the practice, but who are deemed necessary to be part of that team. To create that kind of multiple speciality sort of team. And I can specify the type of membership each has, whether they're the coordinator or a member of the team. And then each member can also have a particular role, and that can range from a clinical kind of role to then a non-clinical, such as a family member, etc. And all of that in combination will also decide the accessibility, a level of accessibility that each care plan member will have, or care team member will have, when it comes to the patient's care plan and when it comes to the patient's medical information. And then once I do all of that, I would click save to save the care plan. And at that point, I could start to add goals and activities, and those activities can be assigned to any member on the care plan team, including the patient themselves. And the patient will be able to view their care plans through their patient portal, and they'll be able to access them and then interact with the different activities and add notes and mark which activities they've completed and which are still in progress or they failed to achieve, and so on. So we have both a task management engine within the system and a recall management engine. And as I was saying before, the prompts that are generated can be linked to recall. So by clicking on a prompt, you can generate a recall. But if you want to view any recalls or add recalls outside of those with the prompts, you can do that through here by clicking on recalls. And then there's a recall contact list section within the administration tab, where recalls can be managed sort of en masse for the practice, and different templates for text messages or letters or even patient portal messages can then be automatically generated depending on the type of recall, and they can be sent out to the patient as and when required. And as well, the task management tasks are more for the clinical users, and you can set up or you can add tasks through here, or a task can be automatically generated, again linked to the prompts if necessary, or follow-up tasks are generated based on lab results and so on, and all of that can be done automatically. If you need to view any reports within the system, simply go to report here. There's a kind of predefined suite of reports that you can access, and they're all there. And you can also access an ad hoc query builder as well if you wanted to create ad hoc queries.